I'm a third-year OBGYN resident at Wellstar Kennestone, and the case I wanted to present is a rare case of metastatic cervical cancer in twin pregnancy. So just a little background, cervical cancer is the fourth most common cancer in women worldwide, and it's the seventh most common cancer worldwide in general. When we diagnose cervical cancer, it's usually in the 30s and 40s, most typically in the late 40s, with an average diagnosis of age 50. The incidence of cervical cancer in pregnancies is actually quite low, and when diagnosed, it's usually at an early stage and confined to the cervix. So there's been literature out there that show that pregnancy can accelerate the growth of cervical cancer, but the entire mechanism is actually quite unknown. Even though we do have the HPV vaccine now that significantly decreased the incidence of cervical cancer, it's still a major cause of morbidity and mortality, especially in this patient here. So this is a 26-year-old gravida 2 pair 1. She is an African American female who transferred care at 21 weeks of gestation from the Bahamas. She had currently a dichorionic diamniotic pregnancy, twin pregnancy. When she came to us, she already had a known diagnosis of history of cervical cancer back in early 2020, where she received 5 rounds of chemotherapy, but was not offered any radiation. And at that time, she was not pregnant. So a couple months later, she did get pregnant and was found to have recurrence of disease at around 17 weeks gestation when they performed a colposcopy exam back in the Bahamas. Now, when she came to our clinic, we did an exam in it, and she had a 4-centimeter fungating friable cervical lesion that was grossly evident of cancer. She also had this 6 to 7 centimeter retroperitoneal solid mass that we could palpate. And at that time, even slight manipulation of the cervix, there was bleeding. So we had to use several different hemostatic agents, and we sent her over to get admitted to the hospital. When she got to the hospital, we did an MRI, and it showed a lobulated 3.8 by 6.9 centimeter cervical mass with a large mass in the retroperitoneum involving the iliopsoas. The mass was 16 by 9 by 19 centimeters. Now, a fetus, like a head of a fetus, is usually 10 centimeters. So you can imagine this was a huge mass that they found. We ended up doing a biopsy, and the masses both were confirmed to be metastatic squamous cell carcinoma. Now, the care of this patient was quite difficult because at this point we had to decide a treatment plan that would benefit the mother and get her babies to viability and have a chance at survival. So in the end, she did elect to try to get her babies to viability. And at our hospital, viability is 24 weeks. So what that means is that 24 weeks of gestation, the babies had around a 40% chance of survival. She underwent a primary C-section, delivered 2 viable babies. However, one of her babies did pass away on day 3 of life from complications of prematurity. The other one is, to my knowledge, still alive to this day. So after she delivered her babies, we did an MRI again, and it showed interval enlargement of the cervical and the iliopsoas mass, and she had distant widespread metastasis to bone, liver, ureter, bladder. It was throughout her whole body. And she was started on chemoradiation with weekly cisplatin, and the plan was to do multiple rounds of palliative radiation, but this wasn't completed because she ended up actually moving back to the Bahamas with her baby, and she actually passed away a couple months later. So cervical cancer, the symptoms can be quite vague, but they can present with things like vaginal bleeding, postcoital bleeding, pelvic pain, urinary frequency. But what's surprising is that when cervical cancer is metastatic, it can actually be asymptomatic. And this patient, when she presented, she was pretty much asymptomatic at that point. So the treatment that she received was chemotherapy, but the standard of care for when you're diagnosed with locally advanced cervical cancer, which is what we thought she had back when she would first receive her diagnosis, is chemotherapy along with radiation, which this patient did not receive. So this really illustrates a comparison between what this patient was offered and what treatment plan was deciphered by the documentation she provided for us versus what the standard of care should have been. And because her cancer recurred in the second trimester, we were really limited in our treatment options. And the only thing we could offer at that point was chemo during pregnancy if she wanted it, and radiation in the postpartum period. So this case really shows, what a delayed management of cervical cancer could present with, and led to like a very unfavorable outcome for this patient. Okay, that's all I had.
All righty, thank you so much. The only question we have is, what chemotherapy did she receive?
Yeah, so she received cisplatin. So usually with cervical cancer, the treatment is carbotaxol, which is carboplatin and cisplatin therapy together, and that is what she did receive. She received like 3 or 4 rounds of that before she moved, but the plan was still to follow up with radiation, which she didn't end up receiving.